Hello, guys. Uh, Good evening. Hope all of you are doing well. Today, we are going to discuss about acne in our class, and hope we will be all attentive and will ask questions. An interactive kind of session that will always encourage us, guide us how to handle acne in a today topic. Thank you so much for being there with me. So, I can just start with, I know everyone have heard about acne. Acne is very common. Is what they said is some a lot of literature have described acne. Acne is a condition that is very common worldwide and it's mostly among the young adults. You see, this condition is one of the terrible condition where most of the adult populations go through. So it is not just about pimple. Some people say acne is a pimple, but acne is not just a pimple. Yeah, acne is one of the most common conditions worldwide, and I know from where you are seeing me, from where you are watching me currently, acne is one of the conditions that is affecting people in your population, in your healthcare setting. What we know is almost 20 to 60% of the conditions that we always check in our in our consultation nowadays in our clinics present with acne. Some people try to ignore it, that is just a simple, but as we said before, acne is not just a pimple. Acne is a dermatological condition where it affects mostly adolescents, adults, and even infants. You can see in our infants, you can see in our adults. So it is a condition that is varying in kind of presentation of which you may not understand. Sometimes you will see that it is maybe it's a normal condition, but acne is a disease, is a condition, and is a dermatological condition that need to be addressed. The major cause is a major cause of low esteem and anxiety and social withdrawal. Sometimes you see people with acne, you see that there is that low self-esteem kind of thing, there is that anxiety, that's a kind of social withdrawal. You cannot get associated with people, you cannot be with people, you cannot stay with them because of the kind of presentation, because of the kind of appearance. So it causes some cosmetic kind of disturbances. So acne, it is a condition that we need to really address. Most people suffer in silence because they think acne is normal, or there is faulty somewhere. That is an outdated kind of thinking. So we do better now by addressing acne, by presenting acne to the healthcare center to be. So the bottom line kind of thing. So acne is a medical conditions, not poor hygiene or punishment from bad food choices. So in general, what we can say is acne, by definition, is a chronic inflammatory disease of a polysebaceous unit. I know we know where the sebaceous is produced. The sebaceous gland is produced. It is inflammatory disease of the polysebaceous unit. That is the hair follicle and its oil gland. Overproduction of the sebum. Sometimes you see they say it is over secretion of the sebum. So it is the disease of the hair follicle and its glands. It mainly affect more. It mainly the presentation varies from people to people depending on which status depending on the cause. You see, acne, but in real presentation, acne mostly present affect people in the face, in the chest, in the back, in the shoulder. I know we have all seen this kind of presentations of acne. Some you see them here like purple, blackish, whitish. These are sometimes we describe it. A dermatological language is like we have the comedones, we have the papule. The comedones are we have sometimes the close and open comedones. The close one you will see that some white kind of white comedon still here. That is what we call it, the close comedon. But the open head comedon is already open, and those white kind of cells have already come out. So it gives like something of a cast which is already black, which is post-inflammatory. But acne is a disease. So mostly there's many people who get acne, to be sincere. If we ask, uh, acne is almost 80 to 90% of the adolescent experience acne in real sense. That's why I'm saying wherever we are in our healthcare setting, wherever in our consultation room, we see most people present with acne, but some people thought acne is normal. That presentation in the face, in the shoulder, in the back, it is normal. There is increasing cases in adults, which is mostly adult over 25 years, especially female. There is an increasing cases of acne. Both male and female are affected, we know, but mostly female are affected. Acne is more severe, as I said. Sometimes we can describe acne in other different forms, but acne, more severe acne, often seen in male. See, when it's presenting already in male, it is a more severe form. More severe one is, this is what the other literature says. More severe more kind of acne present in male. Adult persistent acne is more common in female. You see, are you seeing these differences? It is not common with male, but when it's already presenting in males, when it's already showing up, it's a kind of more severe kind of acne. But the persistent acne is more common in women, meaning women are mostly getting this acne more of the time. So no, acne is not just for teenagers. That is the myth that need retirement. That kind of myth that acne is for teenagers, it need to be retired. Okay. Sometimes how do acne develop, or the pathophysiology of acne? This is how acne is developed. Acne doesn't happen randomly, to be sincere. It follows four classic mechanisms. That is the old school dermatology, still undefeated. No new development have been made to defeat this four classical. The one, that increased sebum production, as I said before in my first introductory part. There is increased sebum production that driven by androgen. We know where the androgen come from. It is driven by androgen, especially during puberty. During puberty, the androgen become active in secreting more sebum. So overproduction of sebum, more brought more oil and more problem. You see, more oil, more problem. Acne from this is when we talk about this, these are like they say hormonal acne. Sometimes you see this causes, it's like from hormonal. More sebum production, which is driven by androgen, especially during puberty, producing more oil, causing more problem. You see, another part of physiology. We can also talk of how do you say follicular hyperkeratinization. When you say about follicular hyperkeratinization, what do we mean here? Dead skin cells. We know the process of proliferations of the skin of the skin. Dead skin cells stick together. Dead skin cell, they stick together. After sticking together, what happens is they block the spores. You remember how the hair follicle is come out here. When there is dead skin, they stick together and they block the spore. When they block the spore, they cause what? The traffic jam. It is like, you see, sometimes it's like we are moving in the road, causing traffic jam, causing more problem, causing more accidents. So in the traffic setting, but which is applied in the same here. Dead skin, they stick together, blocking the spore. After blocking the spore, they cause the traffic into the that's supposed to leave the production of semen, those oily kind of thing to be coming out. So they causes the jam in a hair follicle, blocking the oil coming out, leading to the production of papule. You see this comedos, you see this presentation in there, on the face, on the back, on the elbows, on the chest. You see, another thing is, or that we need to talk is how do we call it? Cortibacteria acne. There's something we call it cortibacteria acne, or we can write it in short form with C. acne. C. acne, this is a bacteria that loves oil. It multiplies fast and trigger inflammations. You see, there is this bacteria that loves oils. So they consume this oil. After consuming the oil, they multiply very fast and they trigger what? The inflammation, because the body has to react to the bacteria that is coming in the body. After coming there, so the immune cell has to reacting, causing inflammation, leading to the presentation of acne on the face. Another thing is we can talk in this pathophysiology is the inflammation. What do you say about inflammation here? Inflammation, when by it we can see there's redness, swelling, pain, and now you have visible acne. You see now, you will see now the visible acne. There's already redness, but this is now already coming into the presentation. There's already swelling, there's already pain, and now here you have to see now the acne. The acne. So the key message here that I want to tell you is acne is not caused by that or what. Washing your face 10 times won't cure it. Might even worsen it. You see, acne has it caused from bacterial inflammation and the rest of the thing, and from hormonal. You see how they are connected: hormonal, bacterial, going up, causing the development of acne. There is type of acne lesions. You see how they present. As I said before, I mentioned some of the same people like comeders, like papule. There are many types of acne lesion. To make it serious, to help you understand the severity, or to help maybe one day, one time you want to present to your patient, you want to tell your patient to understand how the severity, how this. There are type of acne lesions. There is non-inflammatory lesion and there is inflammatory lesion. In this non-inflammatory lesion, as I said before, there is open comedones. There is the comedones. In the comedones, we have divided into two. There's open comedones, there's closed comedones. Open comedones, as I said, they have a black head. You can see those presentations of acne in the face, where in the chest, you see in acne with black head. That's already open comedones. You can even see when you inspect, you will see that the head is already open. These are the open head comedo. It is presented by black appearance. We have also another one which is called the closed comedo. The closed comedo here is present with a white head. You will see that it is still very close. It still have that white thing here, like a cheese. You know, when some people, like when they see the acne lesions here, they want to open it and squeeze it to come out. You will see something coming from there. Like sometimes it's like a thick pass, or sometimes it's like a cheese, but mostly present like a chest. Yes. That is the presentation of non-inflammatory lesions, type lesion of acne. Another type of lesion, which is, I said before, it is inflammatory lesion. In this inflammatory lesion, there is divided into many. There is papule. You can see this papule. This papule is some of them are very small. You can see. Some of them are just very small. Some of them you can see the red. So you can see the small size, you can see the red side, you can see another one red side. Some of them are very small. You can even, if you do not inspect, that's why we say when we are trying to deal with dermatology patients, you need to touch. You need sometimes touching help you identify which kind of lesion you are dealing with. We have pustules in this inflammatory. Pustule, as we said here, the papule, pustule, nodule, and cyst. In papule, I said they are small, red, and raised. You see, you can see them very small, red, and raised, or erythematous. Pustule, what do we say by pustule? Pustule is pass-filled. You see, it is raised, but they present sometimes like papule, but in this, the pustule one is a little bit raised, and there is pass-filled in. This is the pustule. The nodule is very deep. Sometimes it is very painful. Sometimes it's not, but most of the time it's very painful. The nodule lesion of acne. It is deep and painful. This is very severe now, severe and scarring type. You can see after the presentation that's already scarring. You see some of them they present here. You see that it will make the scarring. It's a very scaring type of acne. So when you see the cyst, it's already very scarring type. So what I can say is, the deeper the lesions, the higher the risk of scarring. You see what we are trying to say here. So acne needs to be managed early, at the very early stage, not to go to that complicated stage. You know, this kind of presentation of the already disease, they're not this already acne that have stayed for a little bit long. So there's need to address acne at the very early stage. So you will see the message here is in the presentation, in the types of acne lesion is the deeper the lesions, the higher the risk of scarring. That is the message you need to pick. You need to pick from here. Acne also, as I said before, what I can say here is acne also can be great. You know, as I said, there is a little bit mild part up to severe parts. So we can grade acne into different what else is it? We can grade acne here into how they present or how they have how to the severity. Acne are classified or grade into three. This is a clinical sense to meet a strategy of treating acne. You see, we have the mild acne, we have the moderate acne, we have the severe acne as before in the present. The mild acne mostly you only see the comedones plus few or minus papule. Mostly you will see the comedones in a mild acne. You see the comedones plus or minus papules. And if there's papule, that is very few. They will not be very many. The moderate acne here, like I said here, the moderate acne present with papule and pustule. You will see those papule, yes, you will see papule, and you will also see pustule. You will see the pustule, as I said here, the papule is a little bit small, red and raised. This, but the pustule is a fluid field. You see also a phrase, but it's a fluid field. That's the different. How we differentiate the pustule from papule. But the pustule is a little bit larger, not thin as acne, not small as the one for papule. So there is also, as I was severe acne. This severe acne, as I said before, you will also you will see the nodule, six, and scarring. So sometimes you see some of them the lesion is already like healing, but you see the scarring, you see that hyperpigmentation or hyperpigmentation, but mostly you see that hyperpigmentation is already a severe form of acne. So why we do grading? Why grading matters in here? We do the gradings here. Treatment of acne depend on the severity, not five. We don't five here. If you don't classify acne, you will not know what you are dealing with, what you are treating. You will not know which medication is to give you. So you need to do what you need to do is you need to go to grade acne, into mild, moderate, and severe, so that you can see which medication to give at which time. Another thing is, what would I want to us to address in here in this acne lecture is the factors that worsen acne. We have some factors that lead to acne to be worse. Before, in the part of physiology, we have talked a lot of things. We have talked about the hormone, the androgen, inflammatory, you see, follicular hypokeratinization. You see, these factors also are driven by those. When you see whatever we're discussing in the pathophysiology, you will see that we identify that there are some factors that make acne worse. What you can say here, as we said before, we have hormonal factors. Hormonal factors which is mostly present during puberty for women who, and also in women who are undergoing menstruation, women who are taking oral contraceptive. So this thing increase the production of androgen, leading to the higher let's say here, leading to higher sebum production. Higher production of sebum cause blockage in the pore. Causing blockage in the pore lead to those showing of the of acne lesion. Another thing is acne is also driven by genetic. If your parent or your family, mostly from parent, if your parent have had acne by then, most of them will have been having, or maybe from the mom or from the father. But if acne have been there with your parent, there is also a chance of you getting acne. I know, yeah, there is no what they say is there's no research that has been done to support this, but there is a belief that genetic contribute to acne product to acne presentation. Another thing is acne is also driven by cosmetic that we put, what we apply. That's why most percentage of acne goes to women, because women undergo all those things. They put on different kind of cosmetic. Women undergo menstrual cycle. Women like being on oral contraceptive. There's a lot of things here that drive you will see already when you're going through it. You will see that why there was difference between men and women. So there's also cosmetic. What do we say? What I can say about cosmetic here, there is those cosmetic that has the comedogenic products. So these comedogenic products triggers the production of comedos. That is, you see, as I said before, acne is mostly all about the blockage of the pore. You see, the hair follicle coming out, there is those small hole that allowed the production of oil to come. When there is sebum production, it it allowed it come out. This sweat comes through the pore. So applying on this cosmetic block the pore. So blocking the pore causing acne. Another thing also we can say is about drug also like steroid, anti-epileptic, some contraceptive. You see, all contributing. This is all a contributing factor for the worsening of what, of acne. You see, some people also say there's diet. Some people talk about diet in this conversation. I tried reading some some literature, by then they say some people say diet, but there are still controversial. But it is relevant, they say. So high glycemic foods contribute to acne. Excess dairy like from kettles also, especially the skim milk. You know the skim milk also contributed. They also said chocolate alone is not the violent, but let's stop the rumors. Some people said, you see, some people said also chocolate is also a contributing factor, but not so. Yeah, some literature talk about it one, but a lot of literature have denied. They said this rumor need to be to be stopped because there is no proof that the chocolate is also one of the contributing factor to acne production. One thing is there is that psychological impact. What I what I can say here is acne can cause lot of things. You see, people with acne, I talked before in the introduction, people with acne have a lot of things, has that kind of low self-esteem. You look at yourself and you're a little bit very discouraged with your own appearance, causing that depression, causing that social isolation. You cannot be with people. You want to talk about social isolation here and playing together, being with people in a communal places like being together, discussion, doing other things because of the appearance of your body. Acne is a concern by then. You see also, see, body image issue is very important. Some people say the body image issue is very important so the important message what I can say here is treating acne early is not cosmetic luxury, to be sincere. It is a mental health care. You see, we need to address acne at early stage. So I know you are picking a little from here, but this is the fact about acne. Management of acne, what I can say here is not magic. It's just consistent, evident, and best care. You see, there's no magic you need to do you need to perform to cure me, but just be consistent, evidence based, and treat acne. You see, the general principle what I can say is acne take time to improve, to be sincere, mostly. That's why you see people, our patient, we need to be scheduled for follow-up after mostly like some people schedule for uh, 1 to 2 weeks, some people schedule for a month, but mostly you can prescribe a patient, give medication for 1 month, you advise the patients, you deliver health education, the patient will be on medication for 1 month, then they come again for another uh, discussion, for another review, so that you can see what to be done. So the general principle with acne take time to improve, so mostly from 6 to 8 weeks minimum. This is it. Initial worsening, that is causing failure. Okay, so consistent beats aggressions of this. So let focus on how we manage. Again, we need to be very consistent to our medication, to our management. We need to advise the patient. We need to be peaceful with the patient so that we achieve the goal. The best thing here is be consistent. Handle your patient. Follow up. You will get the best out of your what do I want to say? You will get the best out of here. So what we can say here is to say we can start with topical. If it is mild, sometimes yes, topical for mild to moderate acne. You see, mostly mild to moderate, we can start with topical. Okay, we can benzoyl peroxides 2.505%. We start with it depending on how heavy, but yeah, and mostly we prefer 5%. we prescribe to a patient to take. Or sometimes if there's no, we can go also for topical retinoids, adapalene or retinoid. So we give the patient, be on it for at least 1 month, then come, we'll see the review. If it is worsening, we shift to another line of management. But the best management is from mild to moderate. We give the topical among benzoyl peroxide, topical adapalene, and topical antibiotics. Best way. All this combined. What I want to say here is benzoyl peroxide, topical retinoid, please combine with antibiotic. Always combine to achieve. Also, we see something, we talk about Cutibacteria before by then. So this is what I can say here. Systemic medication, when to give systemic medication? It is from moderate to severe. Sometimes before there, moderate, you assess the moderate. If it is a little bit still moderate, can be moderate almost to severe or moderate. You just need to be well observant. Okay, for moderate to severe, oral antibiotic, short term only, maybe 2 weeks. Yes, hormonal therapy to female if it is available, but we can go for isotretinoin, the big and use carefully. Isotretinoin, you need to screen the patient. You need to see if the patient is planning to get to be on pregnancy within, or the patient is pregnant. Is contraindicated. The isotretinoin. So advise the patient. See if the patient is, when the patient is going to start planning for pregnancy. Another thing I can say here, or what I want to say is here, acne scarring or complications. So acne causes a lot of complications, which is scarring, which is part of it. Complication. There is scars. Scars can be preventable. Permanent one forms. You see, when the scar is formed, it's already permanent kind of thing. The lesion will not disappear. However, we try to modernize it. But acne, these scars are preventable. There is a lot of types. There's ice break scar. We have the box scar. We have the rolling scars. We have the post-inflammatory hyperpigmentations. So early treatment lead to fewer scars. That is it. We manage acne early, fewer scars. We leave acne, we manage at the last stage, more scar. So we need to prioritize. We need to give patient health education wherever they see this kind of lesion presentation. Please attend the medical. Please visit the health center. Your acne will be managed. That is the goal. Complication is based on early treatment. Early treatment, fewer scars, no complications. That is the best lane. So there is, people say, all I can say here is there is common myth to debunk, or some people love say acne is due to poor hygiene, popping pimple helps, sunlight cures acne, acne will always go away on its own. This, as I said before in the introduction, let's try to retire this understanding or dismiss with dignity. Acne, it is not due to poor hygiene. Acne is not popping pimple, right? So that is the miss. Some preventions and skincare advice. All I can say is simple, traditionally effective. Simple, what I said here, traditionally, is your medical tradition. Very effective. Gentle cleaning twice daily. This is medical advice in the traditional way. Gentle cleansing twice daily. Non-comedogenic products, as I said before, comedogenic products causes acne. So non-comedogenic products, no risk of acne. Avoid picking. You see, avoid picking. Adhere to treatment. Seek medical advice early, or only wisdom still wins. You see, seek medical advice early. only with wisdom, stay well. Lesions is small. Conclusion, what I can say here is, in the conclusion, the take-home message. I know everyone, some people. When I was, in some of the classes, some people are waiting for the take-home message. Huh? What is a take-home message? What is a take-home? Some people, they believe in when they see this take-home message, it is something they will put in mind. Take-home message: acne is common, it's treatable, not your fault. So people should not take that acne. Maybe this is my fault. Maybe. Acne is common to everyone. Otherwise, acne is 80 to 90% of the worldwide. This is the epidemiology. So acne is common, treatable, not your fault. Wait, early interventions, correct informations, patience and consistencies. That is what I can say. It's common, treatable, not your fault. Wait, early interventions, correct information, patience and consistency. Clear skin is not a miracle. It is management. So this is what I can tell you. What I can close with, or the closing line is, acne does not define your beauty, your worth, or your future. It is a condition, and condition can be treated. That is it. So guys, this is all about acne today. Thank you so much for being there with me. Thank you for attending this class. Thank you for being patient since the start of this half an hour discussion. So take acne serious. Thank you. My name is Omwony Samuel Ilemu, a dermatologist and venereology student, RDTC, Tanzania. Thank you. I'm a South Sudanese.